Peace of mind is often the reason women give when deciding on a double mastectomy. But does it really provide peace of mind to breast cancer survivors? Another reason often heard is, I'm going to fight this with all I have. Does more aggressive treatment lead to better cure rates? Let's explore the evidence together. Welcome to the third video in the series by Just Medicine on double mastectomy. If you have already viewed our first two videos, you will know that in this series, we aim to review the data comparing the outcomes of bilateral or double mastectomy with unilateral or single-side mastectomy and breast conservation treatment, or BCT. In this, our third video, we plan to discuss quality of life issues associated with surgical treatment of breast cancer. You may wish to watch our first two videos to provide the context for this chapter. Please note that this is solely an educational video and is not intended to replace a surgical consultation. Do see your doctor to review your specific circumstances and for treatment planning. Here, Dr. Tan will present the data which form the basis for surgical recommendations and trust that it will help you to make the right decision for your treatment. Let us begin.
Thank you for joining us for this third chapter in our series on bilateral or double mastectomy. As a recap, we have already discussed the survival outcomes for both bilateral mastectomy and BCT. To date, there is no evidence to demonstrate any difference in survival rates between these two modes of surgical therapy. In fact, current data appears to suggest that BCT may offer better survival rates for women with early-stage breast cancer who are not at high risk of recurrence. We've also presented the data showing a higher risk of complications with mastectomy than BCT. In this video, we will explore what research tells us about the issue of quality of life after completion of breast cancer surgery. There are many dimensions to quality of life in survivorship following breast cancer treatment. These researchers based in Sweden sought to understand some of these domains better. Here is a study looking at quality of life issues up to 2 years after contralateral prophylactic mastectomy or CPM. In an earlier video, we discussed why almost all women with CPM have a bilateral or double mastectomy. From this chart presented in the study led by Dr. Unukovych, we can see that a significant proportion of women continued to have body image issues 2 years after CPM. The majority do continue to interact on a social level, with less than 15% avoiding people. However, a significant proportion of women are self-conscious and are dissatisfied with the appearance of their body and scars. In this separate study, researchers in New England found that some women clearly expressed their wish not to take any chances about recurrence and tended to make decisions for bilateral or double mastectomy, even if they were eligible for breast conservation treatment. They cited peace of mind, perceived improved survival, despite lack of evidence of medical benefit, and reduced risk of contralateral breast cancer as the most important reasons for choosing CPM. Allow me to explore these reasons one at a time. The researchers for this study from the United States highlighted the same patient concerns as was discussed by the Swedish doctors. In both groups of women, body image was a concern. The authors also mentioned that in spite of their confidence preoperatively with their choice for bilateral mastectomy, some of the patients indicated some regret regarding their surgical treatment when surveyed 5 years after their breast cancer diagnosis. Concerns with body image after CPM is a recurring theme across several studies which looked at quality of life after breast cancer treatment. Apart from body image issues, this group of doctors from MD Anderson and Memorial Sloan Kettering cancer centers in the US took their work one step further and looked at quality-adjusted life years, QALY for short. This metric measures not just survival but the well-being of a patient into survivorship. We can see that there is a negative QALY benefit for women with operable breast cancer with no family history of breast cancer. When women were asked what they wished they had known before undergoing double mastectomy, more than half of the patients wished they had specific information about the potential for negative emotions following surgery. This is what my role is in presenting this information to help women who might be in a position to make a decision about breast cancer surgical treatment. The key point in this study is that the analysis showed that women had higher cancer distress and lower quality of life after contralateral prophylactic mastectomy compared with those who did not have surgery for the healthy breast. The science therefore shows that peace of mind which patients feel they will achieve with CPM does not always bear out. This is a systematic review of the data available up to the point of publication in 2018. At that time, the authors concluded, after a comprehensive analysis of the evidence, that while contralateral risk-reducing mastectomy, which is another term for contralateral prophylactic mastectomy, did reduce the incidence of contralateral breast cancer, there was insufficient evidence that it improves survival. The researchers also concluded that a number of women may be overtreated with bilateral mastectomy. A very recent publication echoes the same sentiments of the authors of the 2018 article. In this study, it was discovered that decisions to undergo contralateral prophylactic mastectomy are patient-driven. There is a perception that CPM or double mastectomy, being the most aggressive option, is therefore the safest therapeutic modality available. This perception is contrary to current scientific evidence. At this point in time, I would like to reiterate what we have discussed in our first video, that bilateral or double mastectomy does not improve breast cancer survival. In other words, it does not help a survivor live longer. From our second video, we see that surgical science demonstrates that double mastectomy is associated with a higher risk of operative complications. This means potentially more unexpected operations and hospitalizations, and therefore does not allow a patient to live more in the immediate post-operative period. In this, our third video, we looked at the data for how the choice of double mastectomy affects longer-term outcomes in survivorship and have found implications for the quality of life. From the evidence presented earlier in this video, the data shows that not all women will have peace of mind after double mastectomy, and some have negative emotions after surgery, especially if they have body image issues. Some may even have higher cancer distress and poorer quality of life after CPM than those who did not undergo the surgery. These are the issues which women may wish to consider before embarking on double mastectomy or CPM, for it may not allow her the true freedom to live more. Based on all the evidence, our advice is for women to take their time when considering a double mastectomy if their circumstances make them a candidate for breast conservation treatment. In the next video, we will look at a scientific report of a woman who had a double mastectomy against her surgeon's recommendations and her reflections of her decision during survivorship. Let's chat again soon.
Thank you for staying to the end of this video. We trust that you have found the discussion useful. If you would like Dr. Tan to coordinate the evidence for a particular subject, please click on the link to our Just Medicine website and fill in the form. In our next bonus video, we will walk through a patient's journey as she underwent double mastectomy. See you again real soon.